Let me paint you a picture. You are 68 years old. You have been taking your blood pressure medication faithfully for years. Every single morning, you take your pill with a glass of water, just like your doctor told you. You watch what you eat. You try to stay active. You are doing everything right. But at your last 3 checkups, your blood pressure numbers have not come down. In fact, they have crept higher. Your doctor adds another medication, then adjusts the dose, then adds another one. And still, the numbers are not where they should be. Nobody in that room is asking one very important question. Could one of the pills you are already taking be making your blood pressure worse? That exact situation is happening to thousands of older adults right now. And the answer, when someone finally looks for it, is often yes. Not because your doctor made a mistake, not because you did anything wrong, but because certain very common medications, pills that millions of people take every single day, have a direct and documented effect on raising blood pressure, especially in people over 60. My name is Dr. Li Wei, and this channel exists to give adults over 60 honest, clear, evidence-based information about their health. The kind of information that often does not make it into a 15-minute appointment. Today, I am going to walk you through 5 specific types of pills that can raise blood pressure in older adults, how they do it, why the effect is stronger as we age, and most importantly, what you can do about it. Stay with me through all 5, because number 3 is one that almost everyone over 60 is exposed to and almost nobody connects to their blood pressure. And number 5 is a category that surprises even people who consider themselves very health savvy. Before we begin, I want to hear from you. Where are you watching from today? Drop your city or country in the comments below. I genuinely read every single one, and it helps me understand who I am speaking to and what topics matter most to this community. The concept you need first, why age changes everything. Before we get into the 5 pills, I need to give you one idea that makes everything else make sense. When you are young, your body has enormous reserve capacity. Your kidneys filter medications efficiently. Your liver processes and clears drugs quickly. Your blood vessels are more flexible and responsive. Your hormone system bounces back fast. So if a medication nudges your blood pressure up slightly, your body compensates. It corrects. You may never notice. After 60, that reserve capacity shrinks. Your kidneys process medications more slowly, so drugs stay in your system longer and at higher concentrations. Your blood vessels are stiffer and less able to self-regulate. Your nervous system responds more slowly to changes in pressure. Your hormone systems, particularly the ones that control salt and fluid balance, are already running closer to the edge. What this means is simple but critical. A medication that had 0 effect on your blood pressure at age 45 can have a meaningful and measurable effect on your blood pressure at age 68. The same pill, the same dose, different body, different outcome. Doctors know this in theory, but in a busy practice, when a patient comes in with high blood pressure that is not responding to treatment, the first instinct is usually to add more medication, not to look carefully at what is already being taken. That is the gap I want to help you close today. Let me know you are following along by typing the number 1 in the comments. It is a simple signal that helps me know this information is reaching you. Pill number 1, NSAIDs, the pain relievers. You think are harmless. NSAID stands for non-steroidal anti-inflammatory drug. These are among the most widely used medications in the world. You know them by names like ibuprofen, naproxen, and the prescription versions like diclofenac, meloxicam, and celecoxib. Millions of older adults take these regularly for arthritis pain, back pain, joint pain, and general aches. They are sold over the counter. They feel safe. They feel routine. Many people do not even think of them as real medications in the same category as their blood pressure pills. But here's what they actually do inside your body. NSAIDs work by blocking certain chemical signals called prostaglandins. Those chemicals do cause inflammation and pain, which is why blocking them feels helpful. But those same chemicals also play a critical role in your kidneys. They help keep the blood vessels inside your kidneys relaxed and open so that your kidneys can filter properly. When you block those chemicals with an NSAID, the blood vessels in your kidneys tighten. Your kidneys respond by holding on to more sodium and water than they should. More fluid in your bloodstream means higher pressure pushing against your artery walls. Blood pressure goes up. In a young person, this effect is small and temporary. In an older adult whose kidneys are already working at reduced capacity and whose blood pressure is already being managed by medication, this effect can be significant, persistent, and directly responsible for blood pressure readings that simply will not come down. Studies have shown that regular NSAID use can raise systolic blood pressure. That is your top number, by anywhere from 3 to 5 millimeters of mercury on average, and considerably more in certain individuals. That may not sound dramatic, but if your doctor is trying to get you below 130, a 5-point invisible increase from a pain reliever you are not mentioning at appointments is genuinely meaningful. What to do instead? Talk to your doctor about acetaminophen, which is sold as Tylenol, for routine pain management. It does not have the same effect on kidney prostaglandins and does not raise blood pressure in the same way. For joint and arthritis pain, topical NSAID creams applied directly to the skin deliver local relief with far less systemic absorption. Physical therapy, gentle exercise, and heat therapy are also genuinely effective for many types of chronic pain in older adults. And critically, the next time you have a blood pressure check, tell your doctor exactly what pain relievers you use, including over-the-counter ones, how often, and at what dose. This information can completely change the diagnostic picture. Pill number 2, decongestants, the cold and allergy medications with a hidden effect. Think about the last time you had a stuffy nose, sinus pressure, congestion, that blocked up feeling that makes it hard to breathe or sleep. You probably reached for something to relieve it. A cold tablet, a sinus pill, a nighttime formula, a nasal decongestant. Most of those products contain a drug called pseudoephedrine or phenylephrine. These ingredients work by constricting the blood vessels inside your nasal passages, which is why the congestion clears. The tissue shrinks. The passages open. You can breathe again. Here's the problem. Those drugs do not only constrict blood vessels in your nose, they constrict blood vessels throughout your body. That is their mechanism. It is not selective. It is systemic. When blood vessels throughout your body constrict, your heart has to push harder to move blood through narrower passages. Blood pressure rises. In a healthy 35-year-old taking a decongestant for 2 or 3 days during a cold, this is not typically a serious concern. In a 70-year-old with treated hypertension, taking a decongestant regularly for seasonal allergies, or reaching for sinus medication multiple times during the winter, this effect can be clinically significant. What makes this particularly tricky is that decongestants are hidden inside combination products. Multi-symptom cold and flu formulas, allergy tablets, sinus headache medications. People are not always reading labels carefully. They take something that seems like a general cold remedy and they do not connect it to the blood pressure numbers that have gone up that week. Look on the label for pseudoephedrine or phenylephrine. If you see either of those and you have high blood pressure or are over 65, have a conversation with your pharmacist or doctor before using it. What to do instead? Saline nasal rinses and sprays are genuinely effective for congestion without any systemic effects. Nasal steroid sprays, which require a prescription but are widely available, treat allergic congestion directly without raising blood pressure. Antihistamines like cetirizine or loratadine manage allergy symptoms without the vasoconstricting effect of decongestants. If you are here and this is making you think about something in your own medicine cabinet, type the number 2 in the comments. Let me know this is landing. Pill number 3, common antidepressants. The connection. Almost nobody discusses. This is the one that stops people when they hear it. Because antidepressants are prescribed so widely, taken so quietly, and considered so separate from cardiovascular health, that the connection almost never comes up in conversation. I want to be very careful here. Depression is a real, serious, and treatable condition. Antidepressants have helped millions of people and absolutely save lives. I am not telling anyone to stop taking their medication. What I am saying is that certain classes of antidepressants have documented effects on blood pressure, and that connection deserves to be part of your health conversation. The class I want to focus on is called SNRIs, which stands for serotonin norepinephrine reuptake inhibitors. You may know these by names like venlafaxine, which is sold as Effexor, or duloxetine, which is sold as Cymbalta. These are also commonly prescribed for anxiety, chronic pain, nerve pain from diabetes, and fibromyalgia. SNRIs work partly by increasing norepinephrine activity in the brain. Norepinephrine is the same chemical that activates your fight-or-flight response. It increases heart rate, tightens blood vessels, and raises blood pressure. That is its job. But when an SNRI keeps norepinephrine levels elevated as part of its mechanism, the same cardiovascular effects can occur, and in older adults, whose blood pressure regulation is already less flexible, this can produce a meaningful and sustained increase in blood pressure readings. Clinical studies have confirmed that venlafaxine in particular is associated with dose-dependent increases in blood pressure in some patients. This is not rare. It is documented, it is known, and it should be part of the monitoring conversation for anyone over 60 who is taking this class of medication. Another older class of antidepressants, called tricyclics, can affect blood pressure in a different way, sometimes causing drops when you stand up quickly, which raises the serious risk of falls and fainting in older adults. Different mechanism, different direction, but equally important to know about. What to do. If you are taking an antidepressant, especially an SNRI, and your blood pressure has been difficult to control, ask your prescribing doctor directly. Could this medication be contributing to my blood pressure readings? Your doctor may want to monitor more closely, adjust the dose, or in some cases, consider an alternative that has less effect on the cardiovascular system. SSRIs, for example, generally have a more favorable blood pressure profile for most patients. The goal is not to create fear around antidepressants. The goal is to make sure every piece of the puzzle is on the table when your care team is trying to understand your blood pressure. Pill number 4, stimulant medications for ADHD or fatigue. This one has become increasingly relevant for older adults in recent years, and many people are genuinely surprised to see it on this list. ADHD diagnoses in adults over 60 are rising. More older adults are also being prescribed stimulant-based medications for fatigue, cognitive sharpness, or concentration issues. Medications in this category include amphetamine-based drugs like Adderall, methylphenidate, sold as Ritalin, or Concerta, and certain other stimulant compounds. These medications work by increasing dopamine and norepinephrine signaling in the brain, which improves focus and alertness. But just like the SNRI antidepressants, elevated norepinephrine has cardiovascular effects. Blood vessels constrict, heart rate increases, blood pressure goes up. In younger adults with normal cardiovascular baselines, this effect is managed carefully and monitored regularly. But in an older adult with existing hypertension, stiff arteries, and kidneys that clear medications more slowly, the blood pressure effect of a stimulant can be substantially amplified compared to what the same dose would produce in a younger person. It is also worth noting that some supplements and herbal products marketed for energy, focus, or weight loss contain stimulant compounds, sometimes not clearly labeled. Ingredients like synephrine, bitter orange extract, and high-dose caffeine combinations can all produce similar cardiovascular stimulant effects. What to do? If you or someone you care for over 60 is taking a stimulant medication, blood pressure should be monitored closely and regularly, not just at annual appointments. If blood pressure has been difficult to control, a direct conversation with the prescribing doctor about whether the stimulant is contributing and whether the dose needs adjustment is absolutely warranted. For supplements marketed around energy and focus, I strongly encourage you to bring the bottle to your pharmacist and ask them to check the active ingredients for anything that could affect blood pressure before starting. Pill number 5, corticosteroids, the inflammation fighters that come with a cardiovascular cost. This is the one that surprises even people who think of themselves as very health savvy. Corticosteroids are a class of drugs that powerfully suppress inflammation. They are used to treat an enormous range of conditions: asthma and COPD flare-ups, rheumatoid arthritis, lupus, inflammatory bowel disease, severe allergic reactions, Skin conditions. Joint injections for pain. They are prescribed by pulmonologists, rheumatologists, dermatologists, and primary care doctors. They are injected, inhaled, taken as pills, and applied as creams. And in older adults who require them regularly or repeatedly, they carry a significant and well-documented effect on blood pressure. Here's how it works. Corticosteroids, particularly oral and injected forms, act on a system in your body that regulates salt and water balance. They signal your kidneys to hold on to more sodium. More sodium in your bloodstream pulls in more water. More fluid volume means more pressure against your artery walls. Blood pressure rises. In someone who takes a short course of oral steroids for a week, maybe for a bad asthma flare or a severe allergic reaction, this effect is temporary and generally tolerable. But in older adults who require repeated steroid injections for joint pain, or who take low-dose oral steroids regularly for a chronic inflammatory condition, the cumulative effect on blood pressure can be substantial. The challenge is that the treating doctor, for example, the rheumatologist managing your arthritis, may not be closely monitoring your blood pressure, and your primary care doctor managing your blood pressure may not have a complete picture of how often and at what dose you are receiving steroids from other specialists. This is a gap in care that falls to you to close. What to do? Keep a complete medication list that includes every steroid you receive, not just daily pills, but injections too. At what dose, how often, and from which provider. Bring that list to every primary care appointment. If you are on regular corticosteroids and your blood pressure is difficult to control, ask your doctor specifically, could the steroids I am receiving be contributing to my blood pressure, and is there a lower dose alternative or a steroid-sparing medication we should consider? Steroid-sparing medications exist for many inflammatory conditions. They control inflammation through a different mechanism without the same effect on fluid retention and blood pressure. They are not right for every patient, but the conversation is absolutely worth having. The practical framework: 5 questions to ask at your next appointment. I promised you something you can use. Here it is. Before your next appointment, write down these 5 questions and bring them with you. They will completely change the quality of conversation you have with your doctor. Question 1. Looking at every medication I take, including over-the-counter pills and supplements, are any of them known to raise blood pressure? This opens the conversation in a way that most patients never do. Your doctor can run through your full medication list with this specific lens. Question 2. Is there a blood pressure neutral alternative for any of the medications that may be contributing? Not every medication has an alternative, but many do. You will not know unless you ask. Question 3. Should we try removing or adjusting a potentially contributing medication before adding another blood pressure drug? This is the question that most often does not get asked, but it is logical. Before stacking another antihypertensive on top of the others, check whether something in the existing pile is working against them. Question 4. How often should we check my blood pressure if I am on a medication that is known to affect it? Regular monitoring is the safety net here. If a medication is elevating your blood pressure, you want to catch that early, not discover it a year later when the numbers are significantly higher. Question 5. What lifestyle changes would have the most meaningful impact on my numbers at my age? Because sometimes the answer is not about pills at all. Reducing sodium intake, which is the single most powerful dietary lever for blood pressure in older adults. Getting consistent moderate activity, improving sleep quality, reducing chronic stress. These interventions are real, they work, and they do not interact with anything else you are taking. Let me leave you with this. Managing blood pressure after 60 is not just about taking the right pill. It is about having a complete and honest picture of everything going into your body and how each piece interacts with everything else. Your body after 60 is not the same body that responded to medications at 40. Drugs stay in your system longer. Side effects appear where they did not before. And the combination of multiple medications, which most older adults are managing, creates interactions and effects that no individual prescription was designed to anticipate. You are not just a patient following a protocol. You are a person with a specific history, a specific biology, and specific goals for your health. The best care you will ever receive is care that accounts for all of that. The questions I gave you today are tools. They are not confrontational. They are not questioning your doctor's competence. They are invitations to a richer, more complete conversation, and every good physician will welcome them. You have the right to know what every pill you take is doing inside your body. You have the right to ask whether something you are already taking might be making another problem harder to solve. And you have the right to be an active participant in decisions about your own health, not a passive recipient of a prescription pad. If this video gave you a new way to think about your blood pressure medications, please subscribe to this channel. I publish new videos every week, all focused on giving adults over 60 honest, practical, evidence-based information to help them take control of their health in the years that matter most. And please leave a comment below. Have you ever discovered that a medication was working against your blood pressure control? Have you had one of these conversations with your doctor and found something unexpected? Your experience might be exactly what another person needs to read before their next appointment. Take good care of yourselves. I will see you in the next one.